Chronic radicular lumbosacral pain is a unilateral or bilateral subjective and unpleasant sensation such as burning, tingling, or numbness in the median or paramedian lumbar and or sacral area, radiating down to the leg following the dermatomal distribution of the involved nerve roots for at least 3 months. The pain mechanism in low back pain involves inflammation and nerve compression. In the last decade, chronic low back pain has been treated using the minimally invasive method of epidural steroid injections. The effectiveness of this injection in treating low back pain has been widely studied but is limited in pain scale and the degree of disability as the outcomes. HMGB1 has recently been considered to have a significant role in the chronicity of low back pain. Only few studies have linked HMGB1 levels to pain intensity and the degree of disability after epidural steroid injection. This study aims to determine change in the level of inflammatory biomarkers HMGB1 associated with clinical outcomes of lumbosacral radicular pain after epidural triamcinolone injections. This was an experimental study using a single-blind randomized case-controlled trial design measuring change in the degree of pain and disability using pain scale and Oswestry Disability Index or ODI and analyzed by HMGB1 protein levels and also the serum of HMGB1 was analyzed using the ELISA method. A total of 57 participants were involved in the study and were divided randomly into two groups. That is intervention groups. The intervention groups will receive conservative therapy and epidural triamcinolone injection interventions, and control groups that only receive the conservative therapy. Outcomes measurements was carried out 3 times, that is before the intervention, 24 hours after the intervention, and 1 week after the interventions. Normalization of data distributions was tested using the Kolmogorov-Smirnov test. The outcome change before and after intervention in each group was tested using the independent t-test. The comparisons of the change between the two groups was tested using the Mann-Whitney U test, and the direction of the strength of the relationship between the clinical outcomes and biomarker levels were tested using the multiple linear regression. The result: the measurement of HMGB1 protein levels before and after epidural triamcinolone interventions in patients with chronic lumbosacral radicular pain shows a decrease in serum HMGB1 significantly on day 7 after the epidural triamcinolone injection. This decrease was more significant in the intervention group. In comparative measurements of clinical outcomes as measured by the pain scale and Oswestry Disability Index or ODI before and after epidural triamcinolone interventions, it was found that the improvements in pain scale and disability scores were measured on the 7th day after the epidural triamcinolone injections. This reduction was more significant in the intervention group. In measuring the influence of HMGB1 protein on the clinical outcomes of chronic lumbosacral radicular pain before and after epidural triamcinolone interventions, saw similar result. Conclusion: there was an improvement in the clinical outcomes after epidural triamcinolone administration. This was analyzed from the change of serum HMGB1 protein levels. That's the keywords: for this research is chronic lumbosacral radicular pain, HMGB1, epidural steroid injection, pain intensity, and osmosensory disability index. Thank you.